Now here we have a polarity move. There's so many descriptive terms that we could use to describe what we are doing here, Greg and I. But we have left hand down here at his lower lumbar region. Right hand is positioned up here beneath the skull in his cervical area. But anytime that you or I put two hands on a human body, we're doing what we call a polarity hold. So what that means is that the left hand has a negative charge, the right hand has a positive, and zoom, we lock into his chemistry here, so it's sort of like jumper cables on a battery. So even though I'm just standing still, the tissue's resting, there's a lot of inner dialogue going on. We can't really see it, certainly can't hear it, and even more so don't necessarily understand it. But back to the endorphins, you can see now how my hand is just sort of starting to slide again. That's the release of the soft tissue, the myofascial release right there. So we're going right down into his pelvis, through that lower lumbar, and that's just going to feel really, really good all the way deep inside. But again, anytime that you're putting two hands on a human body, you've all, well, some of you, not all of you, but many of you have heard of craniosacral therapy. And usually craniosacral therapy work is a much gentler approach, but I think it would be appropriate, fair, and true to say that this is sort of a form of it. We're at the sacrum down here, and just above the pelvis, his sacral area, which is 5 vertebrae fused together at the tip of his spinal column. Then as we get up through these cervical sections, we're getting closer to the cranium. This would be more of a true craniosacral hold, getting to the cranial of the skull, and then the sacrum right here. You can work right over the clothing. It's very soothing, very comforting, and very healing. You could say mothers are the first craniosacral therapists when they hold their children at birth. Here and here. In this day and age, we've made more of a science out of it. I think we're going to move down into Greg's legs a little bit.